last person I'd like to introduce is the newly re-elected president of WCPT, Emma Stokes, who was instrumental in allowing us to do the seminar. And Emma was talking about the perspective of from an educator. And Emma, what would you like to contribute to our debriefing of the seminar?
Thanks to both of you. It was a fabulous session. I thought it was this is what WCPT does best, and it allows the global community to come together and have these conversations. From an education perspective, because I guess that's what I do in my day job, this is going to require a lot of bravery around curriculum redesign, but I think we're ready for that. I've heard over the past 4 years so many voices at conferences saying, well, we need to educate the students who are going to be the new graduates and the new generation of leaders differently. Now that's going to take some changing within the curriculum, and I think it's going to take a willingness for people to embrace new content, but also to let things go, and that's what we've always said, like, we're great at putting new stuff in, but what have we got to take out? So we've got to be brave about taking certain things out and adding new things in. And so from an education perspective, it's not just the content around the clinical end of things or the content around how do we evoke mastery and self-efficacy in our patients, but it's also about how do we educate the next generation of advocates and leaders, and that we value those skills, because we are going to have big advocacy conversations with policymakers, with insurance companies, with our colleagues in the healthcare professions, and with the media, and with the people who we serve. I think one of the things that was fabulous in this session was the fact that we had 3 very powerful patient voices. Yeah. We didn't leave them behind. Yeah. Because of logistics, they came in by video, but they were powerful stories. Those people are our champions, and they are the people that we need to include in our education programs and in our storytelling and in our influencing. So that's what we need to do. We need to harness the power of those narratives. From a WCPT perspective, I think we have lots of opportunities to help move this conversation forward, to help this paradigm shift be enacted and embraced by the global community. One of the challenges that people face, and it was also fabulous that we had a speaker from Nigeria and a speaker from Nepal, because we all come from high-income countries, and notwithstanding the complaints about our healthcare systems, we live in a world of abundance. There are other parts of the world where there are just not the resources. There's not the resources in education, there's not the resources within the advocacy capacity within the organisation or the individuals, and there's just not the resources within the healthcare system. So we as a global organisation can help that through continuing this conversation that you've been really willing to embrace with us, but also to start creating the communication resources, the tools that people need to enable us to have the conversations with people from the insurance industry, with our colleagues in medicine, with our patients and our clients and our communities and our educators. And that's what we can do as a global organisation, and that's where we bring together the collaborative advantage of a global community.
And I think one of the outcomes from this is this development of some webinars that can be placed on the WCPT platform.
Yeah, absolutely.
That can start creating a translatatory message.
Yeah.
And I think you touch on some critically important things there. That this is such a complex problem. We have to work right across those networks.
And we can leverage our relationships internationally within the World Health Professions Alliance, within the Global Rehabilitation Alliance, within WHO, to start to bring this conversation to those tables. So to me, this is the beginning of a journey. WCPT has undergone a big transformation in the last 4 years. I see the next 4 years about having our role in enabling these kind of conversations to become really crucial, because this is the way we are going to change the delivery of healthcare to the people and the communities who need it all around the world.
So let's make a deal that we all come back and stand here in 10 years' time wearing the same clothes and let's see if we've made the change that we hope today might have started. So
Absolutely.
thank you for the opportunity.
Perfect. Thank you.
And thank you.
Cheers, mate.
Thank you.
Cheers.